So I assume a colonoscopy is at the top of your to-do list. Well, probably not. Like many Americans, you may think it's scary or maybe even embarrassing. Well, I urge you not to put the test off if you meet the criteria for a screening colonoscopy. Colonoscopy is the one thing you can do to prevent colorectal cancer. Hi, I'm Dr. Darren Rowan. I'm a general surgeon at NORTHOAKS Surgical Associates. So today I just wanted to inform you a little bit about colorectal cancer, let you know it's the third most common cause of cancer in the United States. It is also the second leading cause of cancer-related deaths in both men and women. Colorectal cancer is a cancer of the colon and rectum. Many cases of colorectal cancer have no warning signs or symptoms until the cancer has spread. In other cases, colorectal cancer may not cause symptoms right away, but if they do, it may lead to one or more of these following symptoms. A change in bowel habits, such as diarrhea, constipation, or narrowing of the stool that lasts for more than a few days. A feeling that you need to have a bowel movement that is not relieved by doing so. Rectal bleeding, blood in the stool which may make it look dark, cramping or abdominal pain, weakness and fatigue, or unintended weight loss. So what are some of the risk factors? One of which is age. Colorectal cancer can affect someone at any age, but 90% of colorectal cancers are found in people 50 years or older. Another risk factor would be a personal history of polyps or cancer themselves. So if you had an adenomatous polyp in the past, you're at a higher risk for developing colorectal cancer. Even if you've had colorectal cancer in the past and had that part of your colon resected, you're at increased risk of colorectal cancer in the colon you have left. Another risk factor would be a family history of colorectal cancer. Another risk factor would be a history of inflammatory bowel disease. That could be either ulcerative colitis or Crohn's disease. That causes inflammation of the lining of the colon and over time can lead to atypia, which is an abnormality in those cells. Left untreated, it could actually turn into a cancer. Another risk factor would be that of diet. A diet high in red meats or processed meats or saturated fats will increase your risk of colorectal cancer. Even certain meats cooked at high temperatures, whether that be grilling, can release chemicals which have shown to increase the risk of colorectal cancer. Diets high in fruits, vegetables, and whole grains have been linked with a decreased risk of colorectal cancer. Physical activity, a sedentary lifestyle has an increased risk of colorectal cancer. The more active you are, or a healthy lifestyle will decrease that risk. Obesity. Not only does that increase the risk of colorectal cancer, but it increases your chance of dying from colorectal cancer. A healthy weight decreases that risk. Another risk factor would be smoking and heavy alcohol use. Smoking, as you know, has been shown to increase the risk of lung cancer, but it's also been shown to increase other types of cancer, including colorectal cancer. Heavy alcohol use will increase your risk of colorectal cancer. It's advised that men limit their alcohol intake to 2 drinks per day and women 1 drink per day. Colonoscopy can help prevent colorectal cancer or find it at an early stage when it is smaller and easier to treat. The goal is to find the polyps and remove them before they can transition to cancer. If unfortunately you have been diagnosed with colorectal cancer, there are certain surgical options. Those options are determined by where the cancer is located. Usually that section of your colon is removed. The traditional open surgery requires a midline incision approximately this long. Today, we have advancements and are able to use minimally invasive surgery so smaller incisions can be used to remove that portion of the colon where the cancer is. At NORTHOAKS, we've advanced even further and have the robotic platform. The robotic surgery is used in which smaller incisions can be used and precisely remove the portion of the colon you need to have removed. In most cases, it can reduce your hospital stay and allow you to recover and get back to normal activities quicker. Robotic surgery has been used here since 2010. I'm pleased to announce that NORTHOAKS has recently purchased the most advanced robotic platform out there today. So you may be asking who should be screened with a colonoscopy. Today's recommendations state that anyone 45 years of age should begin screening colonoscopies, whether you have a family history of colon cancer or not. And then if you have a first-degree relative, that is your mother, father, brother, sister, son or daughter, who has had either colon polyps or colon cancer, you should be screened 10 years before they were diagnosed. For example, if you have a sister age 50 who was diagnosed with colon cancer, you should have a screening at age 40. What can you expect before or during a colonoscopy? Well, 1 to 2 days prior to the colonoscopy, you'll be started on a clear liquid diet. The day before your colonoscopy, you'll be given a laxative preparation. That'll help clean out your colon. During a colonoscopy, a doctor will ease a flexible lighted scope with a video camera on the end into the colon. And small amount of air will be puffed into the colon so the doctor can see clearly. The exam usually takes 30 minutes to an hour. The patient will be sedated and in most cases will sleep throughout the entire exam. The colonoscope or endoscope is about the width of a pea. If it's time for your colonoscopy, schedule an appointment with NORTHOAKS Surgical Associates. We can be reached at 985, area code, 230-7430. The office is open Monday through Friday, 8 a.m. to 5 p.m. And unfortunately, if you've been diagnosed with colorectal cancer and are in need of surgery, you can call that same number and we'll schedule an appointment to determine what surgical approach is best for you. Remember, the good news is that colorectal cancer is highly preventable, and if caught early, is one of the most curable cancers out there.